So very good afternoon. Welcome to the OMFS Unplugged yet again. Today we'll be starting up with our series, and first the things that we'll be talking about is about the medically compromised patients, wherein the first thing yet again would be the pregnant female. When the pregnant female enters your clinic, your dental office, your main OPD, your hospital, what is the first thing that you see? How do you manage the patient? Because theoretically we know about everything, we read articles, we know about almost a lot of things through our practice, but there are some moments that where we don't know how to go about certain things. So that's what we'll take you through and what we are discussing today.
When practically, as Dr. Surya has told, a pregnant female patient enters your dental clinic or maybe in your major OT setup, what are the things you need to take care of, ranging from the diagnosis, any investigations, and the treatment plan to the execution of that treatment. So let's discuss about this case. A 23-year-old young female patient, actually, she reported to the clinic with some submandibular space infection, and the tooth which was caries, the offending tooth was third molar on the right side. Now the patient was 16 weeks pregnant. So Dr. Surya, I guess we need to tell how have we proceeded with that patient. So that is the crux of this, the message what we want to give here, because in the clinical scenario, sometimes you know things, but when it comes to execution, we are not actually able to execute those things. So at the physiological level, we know it is a physiological condition and it is not something pathological. But in this physiological condition, the young adult female, if you go by ASA classification, it is not the same. Even a young, healthy, adult, pregnant female patient will come into ASA2 category, right? So we need to take some precautions, although it is a green flag to go ahead. Most of the clinicians, they will fear treating that pregnant female patient, or definitely the consultation with the obstetrician and the gynecologist is must before you take up such patients, to know the history of the patient, how many weeks pregnant she is, any kind of medical complications she's suffering from, there was any kind of preeclampsia or not, so hypertension, gestational diabetes. So considering all these factors aside, we consider that it is a non-complicated pregnancy.
So the basic thing is that we need to get the routine investigations done for the patient.
Yeah, definitely.
Like we usually do for our own other patients, even if a pregnant female who comes, the first thing, and that in the case that we were discussing also, the first thing that we got done was the routine investigations, which would definitely include your complete blood count. And in such a patient, the diabetic level also has to be checked.
And considering the gestational diabetes.
Yes, and your PTA and INR is very important, because the pregnant female is already in a hypercoagulable state.
And that's a nice point you have picked, Dr. Surya, hypercoagulability state. As far as the blood physiology is concerned, there is almost 25 to 50% increase in the blood volume, which sometimes leads to hemodilution. And you must have seen most of the pregnant female patient being anemic when they report to your clinic.
Yes. So that's why the CBC is very important, and with CBC, hemoglobin and PCT is very important.
Yeah, exactly.
The hematocrit value.
Yeah. Why PCT or PCV, packed cell volume? Because if you get only hemoglobin done, you may get a wrong information. Sometimes the hemoglobin levels are seen to be like 12 or 14. We know that the ratio of hemoglobin and PCV is 1:3. Yeah. So if it is like deranged, sometimes it may be due to hemodilution, and sometimes in the summers or due to less drinking of water, the patient may be hemoconcentrated. Because of that, the values may seem higher.
Because what happens is that there is increased amount of progesterone which is in the body. Then as a result, there is more sodium retention.
Yes.
With sodium retention, there is more water retention, and hence the blood plasma volume also increases. Now definitely the RBCs would also increase, but the amount with which the plasma increases versus the RBCs is way more.
Yeah.
So that's why there is a complete, the lookout of a hemodilution which is occurring there.
And that too, we need to understand it is during the first trimester, when the blood volume, these changes occur. During
organogenesis is the...
Yeah, coming to organogenesis, now all these three trimesters, what we say, first, second and third trimester, and everybody has read in their graduation, the second trimester is the safest for performing any kind of dental procedures. But why so? Why not in first trimester? Why not in third trimester? First trimester, primarily is associated with organogenesis, as Dr. Surya has told. Now, during this period, the primary consideration is in two things. Now one thing we always discuss about is local anesthesia, or the kind of anesthesia what we are using. And the second thing is the procedure itself.
Yes.
Now, what are the precautions need to be taken? And even post-operatively the antibiotics, or maybe the entire medication scenario, the analgesics also. Intraoperatively, based on your decisions, the kind of anesthesia you are using,
how conservative or how radical you want to proceed,
be. Yeah, exactly.
depending upon the condition and the emergency of the situation.
Yeah. And similarly, for the local anesthesia part, it is the adrenaline which is the main culprit. That too, if injected into a vessel, can lead to vasoconstriction and hypoxia.
Yes.
And that is what is going to cause some problem in a pregnant female patient. Barring that, I don't think there is any problem.
Yeah, so how you correlate it into a patient is that whenever you're giving local anesthesia, you need to be very sure, you need to aspirate it, and you need to be very sure that it's not gone intravascularly.
Yeah, so if you have done your job right, if you have done proper aspiration, you have given a proper block, I don't feel there is any fear to.
And we should use 1:2 lakh.
Yeah, 1:2.
That is
use more diluted form of adrenaline. That is, I always say, all the clinicians, as far as the clinic is concerned, especially for the young clinicians, when you're not sure your nerve block is going to be effective, rather than causing the toxicity, it is more important that you go with the more diluted form.
Yes.
And as far as the second trimester is concerned, organogenesis has already taken place.
That's basically a rapid growth phase which is occurring in the second trimester.
So all the dental procedures and any minor surgical procedures, it is safe to go ahead with all these kind of procedures. In the third trimester, it is primarily the weight, the gravity uterus. The gravity itself means heavy.
Yes.
So the gravity uterus, we call this pregnant female patient, you must have seen the terminology used by the obstetricians and gynecologists. It's a gravity uterus. This means it's a pregnant female patient. So the uterus becomes heavy, and we have inferior vena cava, which is the main venous supply of the pelvic region and the stomach. So if that gets compressed when the patient is in supine position, the patient is lying down, the blood supply is compromised. Return of the blood supply to the heart. So the patient may go. Yeah. So the patient may go into hypotension.
Also, it pushes the diaphragm up. As a result, again, the functional residual capacity of the lungs also reduces. Plus, there's a baby already inside, so even the oxygen demands of the baby is also there. So I feel, the hypoxia state is very common, which can happen.
Yeah.
So we need to be sure of the. Now here comes the role of the positioning of the patient while doing any procedure. So I feel left lateral decubitus position is the ideal position.
Now many postgraduate students or maybe the clinicians, young clinicians, they will ask, sir, what is decubitus? The decubitus means nothing but to lie down.
Exactly.
We call supine, lying down. When it comes to decubitus, means it's a lying down position, but either on the left or right. So when we say left decubitus means left lying position, right decubitus means right. Now why on the left? Because vena cava is primarily lying on the right side. So when the patient even slightly, believe me, even slightly shifts onto the left side, the pressure from the vena cava gets off. It is not that aorta or
abdominal aorta is
not get compressed. It does.
It does,
and that is the reason to cause tachycardia or hypertension in such patients. And the episodes.
This is a very important point.
Yeah,
this is a very important.
Nobody talks about that. Yes. They talk about only venous return. So the patient, may feel syncope kind of situation in this case also. What you need to do is just shift the patient slightly on the left side with the right hip elevation to slightly 15 degree. Now that can be done with a small pillow, maybe a cushion, or maybe some towel wrap. Just slight elevation of the right hip, and give the patient due breaks during your dental procedure. If they need to go to washroom because the bladder is getting compressed, so they need frequent breaks.
Also, like we do for other medical comorbidities, the morning appointments.
Yeah, the morning appointments that will reduce the anxiety. That's always better for any kind of surgical procedure.
So very, very small, minute details are important when we are considering such patients, because when we know about such huge things, the basic small things, the right basics we forget, and that's what we don't do. So that is very important, I feel. So coming back to that patient that we were discussing in the beginning of the video. So after getting the normal routine investigations done, almost everything was fine except the hemoglobin, which was, the patient was slightly anemic, which is, physiologically there because of the pregnancy. However, it was very well corroborated with the PCT. So as a result, we proceeded with the surgery that we had planned, which was just incision and drainage.
So the entire procedure went uneventfully because we have thoroughly checked the history of the patient, and the patient's investigations were done duly. And also radiologically, we need to take care of certain things in a pregnant female patient. And obviously the pelvic region need to be taken care of at that time. So if you have proper shields, you can definitely go ahead with all kind of radiology in the
because the radiation with our set of X-rays,
Yeah.
be it the IOPA, be it the CT scan or the CBCT or OPG, is very less
At the
as
most-
compared to the minimal dosage.
At the most, you can get a thyroid shield
Yeah.
just for that reason. Otherwise, for routine RVGs, you can go ahead with like single or two X-rays. Not going to bother much. Now, the main part comes post-operatively when we have to prescribe medication to the patient. We definitely prescribed the patient. We first thought to prescribe penicillins, but since in the history the patient has told that she is allergic to penicillins,
The other drug of choice that we could give was erythromycin, and for the analgesia, we gave paracetamol.
I guess we need to tell the audience that most of the patients I have seen the clinicians sometimes prescribing the steroids or sometimes giving the injection of steroids to such patients. Firstly, the infection itself contraindicates that. In any infection, you are not supposed to give any kind of steroids because they will lead to ultimately decreased immunity. And secondly, they increase blood pressure and tachycardia and all that stuff. And the pregnant female patient, again, steroids are not going to help. And as such, it was an infection situation. Considering that apart, even if it was some other kind of surgical
So I don't think we can even give Vizolon
you are not
the
supposed
least,
to.
the even 5 mg which we usually prescribe for our cases. That also I think would be a risky
that
thing.
is going to be a detrimental thing.
Yeah, but vitamins, multivitamins is very important in such a patient that we can give
for a better healing. Because the body mass index is increased, so definitely you need some kind of supplements to support the body system, physiological system.
The antibiotics that are a complete no would include your tetracyclines, would include to an extent metronidazole, would include again amecacin, which is really not
especially during the first trimester when organogenesis is going on.
Yes.
So during the third trimester and second trimester, I don't think definitely the discoloration of teeth has been seen with tetracyclines and all. So we need to avoid those drugs in the second or third trimester. Otherwise, most of the drugs are safe actually in pregnancy. So we can go ahead with those.
Now, all these things are also applicable, I feel, when the patient comes in for a major maxillofacial surgery. Cases like, the elective surgeries like orthognathics, like a facial cosmetic surgery, those should definitely be deferred. And a rule of, standard is that everything should be deferred if it's not an emergency when it's a pregnant female. Cases like cancer or a tumor, you don't have an option, but you have to kind of operate them. So the general anesthetic part in that is very important, where increased amount of
it becomes a team effort. It becomes
pre-oxygenation is very much required, and a more amount of close lookout and follow-up of everything is required, whether it's local anesthesia or general anesthesia. So I feel with that, our first part of this series, the first video of our series, is now concluded, and we hope to come up with a newer topic, which we've already jotted down a few topics that we have to discuss. If this helps you, if you like this in any form, then please do join us and do let us know through your suggestions about what we can do good, how we can improve, and what things which were fine according to you. So would love some amount of feedback, because criticism is something which is amazing. So thank you so much for that.
Thank you, and you can drop your queries to us on our channel, and we would be more than happy to answer all your queries, the maximum what we can. Thank you.